Well, this might come as a bit of a surprise, but Minnesota is among the states with the highest rates of melanoma. This according to a recent study by the American Cancer Society. Now, even though we have a relatively low UV index here, experts suspect it is our zest for outdoor activities coupled with insufficient sun protection that leads to the problem.
But our friends at Advanced Dermatology Care showed TCL reporter Kristen Habrick how to spot suspicious lesions and show us a procedure they use to help treat skin cancer.
Skin cancer is the most common form of cancer. Why is it on the rise?
If you've lived through the 80s and 90s, and even nowadays in the Midwest, people are still seeking a tan. We've had a lot of tanning exposure. There's other factors besides that. Our ozone is getting thinner, people are living longer. The longer you live, the more chance you have to be getting more skin cancer. But for the majority of the reason is sun exposure is a huge risk factor.
I use a tanning bed pretty often in high school and in college just to have that bronze look, and I'm wishing I didn't do that now.
Yeah. Well, a lot of us did during the 70s, 80s, and 90s. Tanning was seen as a healthy glow. It's interesting you mentioned that about tanning beds because they are classified as a carcinogen.
Really?
So the other carcinogens is about as healthy as bathing in formaldehyde. It is not a good thing to do for your skin. And melanoma is actually one of the more deadly cancers.
My dad, this is a serious thing that he dealt with, where he had a spot on his nose and had to get Mohs surgery and get it removed because, again, just not wearing any sort of sunscreen in the 80s. What are some things that we can all be vigilant about in terms of suspicious mole, or even the word lesion? Some people don't know what that is.
Yeah. When we look at moles, we look at some distinct characteristics of the moles. With the naked eye, they're called the ABCDEs. So A stands for asymmetry. If one part of the mole doesn't match the other in terms of the color, they're asymmetric. If the borders are irregular, you can almost kind of see it growing off to one side. If there's suspicious colors, like black, like put on with a Sharpie, or white or red, weird colors inside a mole. D stands for diameter, and there can be large benign lesions, but if it's a precancerous or a cancerous lesion, the bigger it is, of course, the bigger the defect is and the repair it's going to need. And then E stands for evolving. Is the mole changing? Those are all warning signs. If you have any concerning lesions, come and get those checked out. Once it's biopsy proven, then there's Mohs option. Mohs micrographic skin cancer surgery is a great option for that.
So, Mohs surgery is a highly specialized surgical procedure where we take a piece of skin and have it looked at under the microscope. Then they put it on a little metal, what's called a chuck, and then that chuck fits inside the microtome, and they freeze it really, really hard. So then a very sharp blade slices that horizontally.
Okay.
So you can look at the depth and the periphery, the edges of a skin cancer, to make sure we get it all. Mohs has been a great addition, since there are so many people with skin cancer, to try to get the high cure rate, 98%, and taking the least amount of normal skin and visually confirming with the microscope that we got it all. We use Mohs primarily on places that you need to worry a lot about taking extra skin, so face, ears, fingers, or if the tumor is particularly aggressive, or if the tumor cells are small and hard to identify. So there's certain indications for Mohs that help us determine when we should use it and when we should not use it.
Everybody needs to check out their spots and be seen.
Be religious about it.
Yeah.
Super important to take a look at your skin, get those yearly checks. For more information about Advanced Dermatology Care as well as Mohs surgery and skin conditions, head to our website, twincitieslive.com.